Hello, everyone. Welcome and thank you for joining us for today's webinar on our quarterly sector performance reports and how providers can use these reports together with their own data to drive improvement. My name is Janet Anderson. I am the Aged Care Quality and Safety Commissioner, and I will be facilitating today's webinar. Firstly, I'd like to acknowledge the traditional owners of the lands on which we're meeting, wherever you are in Australia, and pay my respect to elders past and present, and to extend that respect and acknowledgement to any Aboriginal and Torres Strait Islander people who are joining us for today's webinar. As I said, today we're going to be talking about the Commission's quarterly sector performance report. Now, we produce these reports as part of our commitment to increase transparency and accountability, both from the regulator to the sector and across the sector. And hopefully you're familiar with these reports because they're readily available on our website, and more particularly with the changes we have been making to their content and their format. We're going to talk a bit about those changes and when we introduce them and why, in response to the feedback we receive from aged care providers across the country. Our aim is always to make the report useful to providers through the inclusion of information that's more relevant to you if you're a provider, and with more analysis that you can use to apply to your own services, particularly when it comes to trends over time. So we're going to take you through our most recent quarterly report, which is for quarter one, July-September 2023, and outline how you can use the data to compare your own performance against the sector as a whole, as well as against providers most similar to you in terms of size, number of individual services, and so on. Then we'll hear how complaints data can be used to monitor risk and improve processes and procedures, and the importance of using the sector performance report and our CERS Insights reports, which you may also have seen online, as combined sources of intelligence to deliver better aged care. And finally, we're going to hear from a provider who's already taking the opportunity to use our data to improve their services. And she's going to share with us some practical examples to underline what the sector performance report can do for her organisation and by extension for providers generally. So joining me on the panel today, I'm very pleased I have with me Lisa Peterson, who's the Assistant Commissioner, Sector Capability and Regulatory Strategy in the Commission, Louise Macleod, the Complaints Commissioner, Lana Richards, who comes to us as the Chief Quality Officer of Catholic Healthcare, and Tim Yap, who is from our Regulatory Policy and Intelligence Group here in the Commission. And our guests will all be together for the question and answer session at the end of the panelists' presentations. Before we get into the webinar proper, I have a little bit of housekeeping. You can ask questions at any time. Just use the question box via the live Q&A tab, which will be visible on your screen. We also have a short survey at the end of the webinar, and I strongly encourage you to stay online to access that survey and to provide us with your responses. You can get that survey through the handouts icon on your screen. And we also invite you to nominate topics which would be of interest to you in subsequent webinars. So please fill it out. We do take very close regard of the contents and we use it to improve our own performance. But to start us off, I'd like to invite Lisa Peterson to open the batting. Lisa.
Thank you so much, Janet, and good afternoon, everybody. Thanks so much for joining us for the session this afternoon. So I want to start off talking a little bit about some of the context for the changes that we're making in our approach to sharing data and insights with the sector. When I first joined the Commission, and that was back in early 2022, I held a series of roundtable meetings across Australia talking to senior leaders about how providers are responding to the changing expectations of older people for their aged care experience. And one of the themes that we explored in those conversations was how we measure performance in aged care and what that means for the Commission and for providers. And the key insight that we took away from those conversations on performance is that the Commission can do more to create value for the sector by sharing data and by having more active conversations about what the data tells us. So in these discussions, providers told us that there should be better visibility around how we use all of the data that's delivered to us through mandatory reporting requirements, as well as the data that we collect through our different regulatory functions, so complaints, serious incident reporting, audits, performance assessment, and compliance activities. And you told us that you wanted to see the data that we collect reflected back to you, not just the numbers, but importantly, the insights and observations that we can draw from the data. And you said you were interested in more timely and granular information about how we see sector performance. So where we see strength and where we see room for improvement or a need for urgent action. And you also told us that you wanted to be able to better understand your own performance relative to others in the sector and to help you proactively manage risk. And you said you needed more narrative around the data to understand the context. So we heard you, and we've been working hard on how we can improve the way that we present data and insights to the sector. We tested our early ideas with some providers that we know that are particularly interested in using data, including the Commission's data, to help improve their services. So today what we want to do, as Janet has said, is talk about some of the recent changes to our quarterly sector performance report. But before I get into that, I do want to briefly mention a couple of other pieces of work that we have underway that really go to this theme of data and insights. So we are really investing in our analytical capability to look at our data to better understand what data points or combinations of data tell us about provider performance, as well as performance at a whole of sector level. Because thanks to mandatory reporting, we now have a much richer picture of the sector than we ever had before. And so we're focused our analysis of current data sets in relation to risk. So looking to identify where there might be groups of providers that have different results against sector risks and data sets. And we'll be sharing our findings with you. This work is going to help us to better tailor our regulatory activities, including education and engagement, across different groups of providers, instead of taking a one-size-fits-all approach. Because we want what you want. Which I think is a thriving sector, delivering great aged care for every older Australian. And we want to support the sector to improve the practice of care by sharing what we observe. Janet mentioned our series of insight reports, which provide quite a detailed analysis of what we observe through the serious incident response reporting to the Commission. And so far we've published reports on unreasonable use of force, so resident to resident, and also unexplained absences. And these reports we identify common scenarios that we often see in SIRS presented as case studies and learning opportunities for providers and aged care workers and governing bodies. So really worth checking those out if you haven't already. And we're really interested about your ideas around areas of focus for future insight reports. So if there's something that you'd like to suggest, please do include that in the chat. And now onto the sector performance report. So those of you that have followed the reports over time will know that previously they were much more focused on the Commission's activities for each quarter. And we've changed that, and the report now focuses on what we see rather than what we do. And we're very eager to provide data that's relevant to a broad range of providers. So by looking at factors like location and service types and corporate structure, the numbers of people that you care for and the service types that you deliver. And so we've redesigned our report so we can show more information about the sector around compliance and complaints and SIRS. We're showing information over several periods so that we can all see what changes look like over time. We're bringing in additional information from other sources, such as the Quality Indicator Program. The ambition is to bring as much content together in one place that we can that will give us a joined up picture of the sector. We're also grouping results by provider segments, which is a way that will help providers to types of providers. And we're tying data points together to help us tell stories about issues that might be emerging. And we've got a new deep dive section in each issue with our new In Focus segment. So it's important to know that we're also using the sector performance report analysis to identify where we as a commission need to look more deeply to understand performance, and also to help us to consider where we need to focus our regulatory activities. And these reports enable both the commission and providers to identify the areas that require uplift and help us all to gain insights into what we need to collectively invest in to improve the quality and safety of care. And we know that, providers, you all have your continuous improvement programs, which we would assume is structured around an evidence base that helps you to understand your own performance. And we're really hoping that this report will contribute to that evidence base and help you to find opportunities to deliver better care. And if you're looking for help in building capability, I just need to give you a quick plug. There's a wealth of information and resources on the Commission's website. You can find a range of different guidance materials. We've got clinical alerts from our Chief Clinical Advisor. We have our webinar recordings. We've got all sorts of fact sheets and guidance products, and of course our online learning modules through Alice. And our very popular Governing for Reform program, which focuses on helping providers to lift corporate and clinical governance. That program is now open, available and free to anyone in aged care, and you can find loads of great content on our website. I'll stop there. Thanks, Janet.
Thank you, Lisa. Well done. That was an excellent overview of the new look sector performance report and some of the additional content that we are now seeking to convey through that report, with the very clear expectation that providers will pick it up and use it in a way that adds value to their own decision making, the choices that they are making about where to put their attention, where to lift their efforts and improve their performance, and therefore the quality of life and the calibre of the experience of all of those for whom they're providing care. I'd now like to invite Tim Yap, who works in the Commission as the Director, Sector Performance and Improvement, to present some of the key findings which you will find in this Q1 report, and then also talk you through the way in which you can use that data to calculate your own rates, which then allow you to make best use of the opportunities for benchmarking, where you see yourself in that wider context of your peers, and you can reach conclusions about how you're tracking and what you might need to focus more on. Thanks, Tim.
Thank you, Janet. So we've got our first change to the sector performance report, which is the segmentation of the residential providers. You can see here on the first column at 566, smaller providers are the most common type of provider. And that's because that we treat providers that run 1 or 2 residential services as small. And as you can see here, there are 52 large providers. Those are the providers who run 11 or more residential services. In the third column, you can see that, unsurprisingly, more than half of the services are run by large providers at 1,348. On the second and fourth columns, you'll see how we've broken it down by ownership type. And we'll take you through some of those results by those groupings later on. But first, I want to show you some headline results on compliance. So on the left diagram, you can see that we have a compliance rate with Q1 at 81%. Now, this rate is calculated by taking all the audits we finalised in that quarter, and 81% is the proportion of those audits where the result was full compliance with all 42 requirements of the quality standards. So you can see that's been an improvement over time over the last 4 quarters. On the right, these are the results for each of the 8 quality standards over each of the 4 quarters. And we've highlighted in 3 circles there for you the 3 quality standards which have now the lowest compliance rates for the most recent quarter. So in quality standard 7, you'll see that that one's about the workforce. It has improved over time, which is good. It is now the quality standard with the 3rd lowest compliance rate, tied with quality standard 2 at 93%. For quality standard 3, that's improved a lot. It has reached 90% compliance, and it's now the 2nd lowest in terms of the compliance rate. Quality Standard 3 has always been a concern for us, and you would have seen in previous sector performance reports, there has always been regular non-compliances with those requirements. So that's been improving, but we also wanted to keep improving. And in Quality Standard 8, you can see that's also improved overall, but not as much as the others. So that means it now has the lowest compliance rate of 88%. So we're going to move now to complaints information in the residential sector. You can see here that medication management on the left is consistently the most common issue raised with us about residential care. And it's no surprise that also aligns with the findings of non-compliance we see in Quality Standards 3 and 8 with clinical governance in it. Other major issues through the complaints we get include falls, personal and oral hygiene, personnel sufficiency, which again relates to Quality Standard 7, and communication with representatives and families. On the next slide here, this is more of a feature we just wanted to show you. This is new to the report. We actually give you the most recent result for the quarter, for quarter one in this case, and we show you each of the 42 requirements, it's 42 in the case of residential care, and how our site audit results have shown compliance with each of the 42 requirements. What we've done here is we've highlighted in purple the 10 requirements with the lowest compliance rates. You can see here that out of the five requirements in Quality Standard 8, 4 of them are in the bottom 10. So obviously governance is an important thing for us to look at, and you heard Lisa mention before our Governing for Reform program. So I really encourage you to take up that offer. It's now widely available. If we move to home services, our results for home services, we see a similar uptick in the compliance rate. It is a bit lower than residential care. That's gone up to 63%, and there's a trend there. We've also highlighted again the 3 quality standards with the lower compliance rates, 8, 7, and 3. 8 is, again, these are stories of a bit of improvement. You can see there has been some improvement in 7 and 8. There is still some way to go in terms of improvement. Quality Standard 2 is also on the lower scale of compliance, and that's to do with planning, assessment, communication, and reviews. And we'll see that reflected in the complaints results next. Let's have a look here at home services. Thank you. So in relation to home services, the top 5 complaints, 2 of them relate to communication, consultation, client care and coordination. So no surprise, Quality Standard 2 matches up with that. And the other 3 issues are to do with money. So fees and charges, management of finances, and reimbursements. And you'll hear more about those from our Complaints Commissioner. On our next slide here, we're going to show you how we respond to non-compliance. This is a new graph. On the right of this graph are our firmer actions, where we use our formal powers to compel providers to take action. On the left, we have early remediation, where we have evidence of a provider's willingness and ability to fix an issue quickly without the need for an action like a direction. So this graph is really trying to be acknowledging the ability of providers to fix issues quickly, which is good. If we go to the Serious Incident Response Scheme, we've got here some new facts and figures for you. What we've done here is we've used occupied bed day data, or what we call OBDs, and we use that data from your subsidy claims. This is for residential care, and we use it to create a rate rather than just using overall numbers. We still include overall numbers. So you can see from the left graph for the category unreasonable use of force, there's a notification rate of 4.3 reports to us, the Commission, per 10,000 occupied bed days. What does that mean practically on the ground? If you try to imagine a 110-bed residential service, fully occupied throughout the quarter, that rate would equate to about 4 to 5 incidents in that quarter. So that gives you a sense of scale there. On the right, you can see neglect, another category. This one has the second highest rate and the second highest volume. It is lower than unreasonable use of force, but it has been increasing. And at the top of the diagram here, there's a table showing you the rate for the entire SIRS program, both the quarterly results, but we also show you an average over the 12 months to show you the year rate, as well as the changes over the year. For SIRS in home services, because we don't have occupied bed day data, we don't do rates here. The volumes are much lower, 1,055. You look at the bottom right-hand corner. So the total volume is much lower than in, say, residential at about 13,000. Now, there are good reasons why you might expect fewer incidents in home services, such as the nature of the care being provided, the fact that there is not often 24/7 contact with the home care client. However, a review of our data does suggest that there is likely some underreporting happening here. It's been a year since SIRS was brought into homes. It's been over a year since it's been brought into home services. And we do have some workshops coming up to support home services providers in both managing incidents as well as reporting them correctly to the Commission. So we've also got online learning modules, which is ALICE, as you may be aware, for both home services and residential providers on incident management and SIRS. So if you go to our website, click on for providers, education and training, you'll see links to both our online learning platform and the workshops you can register for. So please take advantage of that. We also have here our quality indicator program data, which is this is data based on the results published by the Australian Institute of Health and Welfare on data that you as residential providers have submitted under the quality indicator program. What's significant about this diagram is that we saw before there was improved compliance with quality standard 3, which is your personal clinical care. And on the screen here, you can see that most of the indicators in the quality indicator program have been trending down, which is an improvement. So there's this correlation there, but also we want to also highlight that the purpose of the sector performance report is to show you different angles on the same thing, because they don't all necessarily tell the same story. I told you before about these improvements, but remember that medication management and falls is still the biggest ticket items in complaints, as well as neglect cases for SIRS has been increasing as well. So it's really important to look at all your data available, just like we do, to get a sense of what's going on. As more of that data that you submit to the department matures, we'll also try to bring that in to tell a more full story. Now, I told you before about the way we've broken down the data into different segments. So I want to show you some ways we've actually been able to break down the data by segments for, again, for residential providers in this case. So on the screen here, on the left, you'll see the compliance rate from our site audit program broken down by ownership type. You can see here as well, in the middle, we've got provider size for complaints and SIRS notifications by provider size. And you can see that there's been, sometimes the lines go together, sometimes they don't. Sometimes different segments are similar, sometimes they're not. That's just one of those things we've noticed by doing this. There's not there's no one indicator is a definitive explanation of performance. So you've got to look at a variety of indicators. That's one thing that we've really learned from this exercise. If we go to the next diagram, the next slide, you'll see that we've broken it up here again. I apologise for the error on the left. But here we've got ownership type, for-profit, not-for-profit, and government. Now, if you just draw your eye to the middle and the right diagram, you'll see that for complaints, there's a bit of a change there and quite a bit of rate change. And on the right for SIRS, we've got two groups that are similar and then quite a big change in government. Now, what we've learned by doing this exercise is that as you break down the groups into smaller groupings, the data tends to get more volatile. So you might find situations where if you're comparing yourself to a metric and you're doing well compared to the metric, the next quarter you might find you're doing worse, not because of you, because the metric itself is changing quite a bit. So volatility is one thing that we want to watch out for. In the next version of these reports, we'll be doing trend lines to show you the trend over time. So you're not only seeing the changes from quarter to quarter. But the other thing that we've took away from this is that because of the volatility, some of the best benchmarks for yourself is you in the past. So we really want you to encourage you to look at your own data for, say, Q1. And when Q2 comes around, look at that data again and compare yourself to the past. Another feature of the sector performance report, which was mentioned before, was we have a new segment called In Focus. And I won't go through the whole lot, but this is to let you know that our most recent report has an In Focus on infection prevention and control. This segment allows us to look at topics like this at greater detail with a bit more data as well. Now, we've been really fortunate. Last year, we ran a provider survey on IPC capability, and we've also run similar surveys in 2017 and 2020, and we've been able to use that to draw some more stories about IPC in that segment as well. Our next report for Q2 will look at restrictive practices, so please look out for that. Thank you.
And that's me back. Thank you, Tim. I was paying such close attention. That is a really fantastic overview. There is so much more there, but I think you've given a really nice illustration of the breadth and depth of the data that we're now reporting. And of course, we continue to look for ways of improving this. And I was just looking at some of the questions coming in, and I expect that there are many watching who also have a few ideas about where we might take it from here, which is just great. Next in line is Louise Macleod, our Complaints Commission. Now, Louise, within the Commission, oversees both the complaints function and also the Serious Incident Response Scheme. And we've heard a bit about both of those from Tim in terms of the way in which they are presented in the Sector Performance Report. But Louise is going to take us into a little more detail. Over to you, Louise.
Thanks, Janet. Hello, everyone. So data from the Commission's complaints function and the Serious Incident Response Scheme, which you see we publish quarterly in the Sector Performance Report, are a key component of how we monitor sector performance and sector-wide risk. And of course, the complaints that we receive also provide the Commission with a vital opportunity to help care recipients get the care they need and deserve from their provider. Now, when we're looking at complaints, it's important to remember that the complaints that we get are only a small proportion of the complaints that you as providers receive and manage directly with the older people receiving your care, as well as their representatives. So that's why it's really important for you to not only have a strong system to deal with complaints promptly and fairly and effectively, but also to have a good working relationship with your consumers and also with your workers that empowers them to raise concerns freely and without fear of reprisal. They all need to know that you regard complaints as a valuable opportunity to understand what's happening in your service and also for working with people in your care to improve their care experience and build relationships with them that are built on trust and confidence. So as Tim mentioned earlier about our online platform, Alice, we've got a module in there about better practice complaints handling, as well as our better practice guide on the website. And I encourage you to make yourself available to those resources. We also published late last year a complaints report that did a deeper dive into our complaints data. And in that, we also provided case studies to help providers step through how you can improve the management of your complaints. So as you saw from what Tim showed you, medication management is consistently the most common complaint issue that we see that's raised in residential care. And we previously analysed these complaints and we found that most of these were due to medication not being administered on time. And that's particularly risky for those in your care who need their time-sensitive medications, such as those medications that are used to treat Parkinson's disease. Now, you'll need to do the same as we have with your complaints data, which is ask yourself perhaps the 5 whys. So asking yourself why over and over again to get beyond the symptoms and to identify the root causes. So for example, if your service has issues with timely medication administration, why is this happening in your service? What's going on? Now, while you're doing that, the Commission will continue to support the sector in various ways, such as with our pharmacy outreach program, which is there to improve the quality use of medicines. Now, if we turn to home services, you can see there that the same issues appear each quarter: communication, management of home care packages, and fees and charges. Now, last year, the government responded by introducing significant reforms to cap some fees and prevent unfair charging. And we continue to help providers to understand these important changes to the home care package rules. There's also unpublished data from the annual statement on provider operations that all providers submitted late last year. And this data suggests there are differences in the mix of complaints that come to the Commission and those that are resolved locally by you. Now, medication management complaints are reported much less commonly by providers through that reporting. And food-related complaints are one of the most commonly reported complaints to providers, but they're not in our top 10 of complaints to the Commission. For future sector performance reports, we will be looking at further differences between the complaints that come to us and those that you're reporting on that are being resolved by you locally. In residential care, the residents themselves are not the majority of the source of complaints that we receive, so they only represent about 7% of the total. And a far higher percentage comes from residents, families, and representatives. And you might find that residents are more likely to raise issues directly with you. And it's therefore really important that you check your own data, so not just looking at the Commission's data, about the potential problems impacting your residents. In home services, the story is a bit different. So the Commission is more likely to receive complaints directly from older people receiving care, although representatives are still a significant source of complaints to us. If we look now at incident management, we've published CERS data for quite some time now. In our reports, we break down the reportable incident data by care type and by incident type and by priority 1 and priority 2. And we have displayed the notification rates by provider segment over the 4 quarters. Now, priority 1 incidents, as you know, must be reported to the Commission within 24 hours, and they may include medical or police assistance. Priority 2 incidents must be reported to the Commission within 30 days of the provider becoming aware of the incident. And while we can show some headline numbers, such as the volume and rate of reportable incident notifications, what really matters is how you look at each and every one of the incidents happening in your service, both individually and also looking for patterns to identify why things go wrong. And then you need to take steps to minimise that recurrence. We're also concerned that providers do not adequately assess the impact of incidents on older people. The impact of an incident can be observable or not. It could be severe, it could be mild, it could change over time. The impact might be physical, psychological, emotional, social, spiritual, on a person's dignity or their rights. And we expect providers and workers to consider the impact of both priority 1 and priority 2 incidents on the older people in their care. So I encourage you to put yourself in the shoes of the person you are caring for. How would you feel if this incident happened to you? Now, to help us with this, we have an insights report which has most recently looked at unexplained absences and unreasonable use of force. And we encourage you to use the case studies to step you through how sometimes the impact on an affected person might be underestimated. We also have an ongoing focus on open disclosure. That is how well the provider and the worker communicate with older people in their care and their representatives and supporters and their families when things go wrong. And this also includes acknowledging mistakes and taking meaningful and serious steps to improve how things are done. So as Tim showed you, the sector performance report is a really useful tool to highlight areas of concern. And as you've seen, the rate of neglect notifications has been increasing, and it's also the second highest incident type in residential care and the highest in home services. Now, because neglect contains many different types of incidents, we've commenced a research project to further understand where these incidents are concentrated. And this will help both you and us take action that will have the greatest impact to prevent harm. And we look forward to sharing this with you in the future. Thanks.
Many thanks, Louise. And you've done a great job of underscoring some of the value, both to the Commission, but also particularly to providers in dealing promptly and in a highly responsive way to the feedback they receive, including registration of any concerns that people using their services may have about that care, and similarly with serious incident response notifications. Moving on now, I'm very pleased to introduce to you Lana Richards, who's the Chief Quality Officer of Catholic Healthcare, and I understand she may have held a similar role at Uniting New South Wales ACT. And what Lana has been invited to do, and has very readily agreed to do, is to share with us the way in which she, in her position, uses the data, both from the quarterly sector performance reports, but also from their own data holdings, to identify risks and to drive continuous improvement, obviously contextualized with their own performance. So thank you very much, Lana.
Thanks, Janet, and good afternoon, everyone. So as you've heard, I'm from Catholic Healthcare. We're a large provider of aged care services operating in New South Wales and South East Queensland. We provide residential care to over 2,800 residents across 41 homes and support more than 6,000 home care clients. My role as Chief Quality Officer is to ensure that care, clinical risk and governance systems are effective, driving continuous improvement and innovation that delivers quality outcomes for the people we serve. Today, I'm delighted to be able to share a little bit about how Catholic Healthcare uses the sector performance report to drive improvement. So as you've heard from Lisa, Louise and Tim, the performance report contains a significant amount of data and insights on how the sector is performing. At Catholic Healthcare, we use the performance report in both our residential and home and community care, compliance and governance forums. In particular, our focus has been historically on non-compliance, trends, complaints and SIRS data. The SPR is an essential source of information for us to understand the trends and compare how we're travelling for the same metrics. And by doing so, we can identify our strengths and opportunities for action. For example, in the performance report, we would ordinarily use it to facilitate a discussion that usually starts by asking ourselves whether or not we're doing better, worse, or the same as everybody else, and considering if this is a surprise or are there any opportunities and what we can do better. At the end of these discussions, the objective is really able to identify the what, the so what, and the what next that we can do, and to share these with stakeholders to drive action. We regularly reference the performance report in our board papers to support and contextualise clinical and compliance performance data for our board members. In more recent times, and with the improvements in the latest report, the insights papers have also been quite informative at driving practice change. In particular, in understanding what might be driving those high rates of reporting and where we can focus our efforts. Given the breadth of services that we operate, there are a range of governance forums in which we use the performance report for quality and clinical improvement. We do both these forums across both our residential and home and community care services. As you can see on the screen, there are a sample of the forums that we have in place. The forums vary in membership and frequency, and that reflects the different stakeholders being engaged. These include our compliance and risk meetings monthly, so that's our version of clinical governance, and we hold both of those for residential and home care. Our clinical risk, incident and safety forums, or CRIS forums as they're called, with a focus on practice development, sharing learnings and continuous improvement. Our care managers workshops that are held quarterly, and that's about building the capacity and capability of our frontline managers in quality management and clinical governance. Our governing bodies, either directly via our board or via our subcommittees, such as the Quality and Safety, who have remit over care and clinical governance. And we also intend on using the updated report as an input to our advisory bodies, which are soon to meet in a few weeks. One of the things that we really value about the report in these forums is that it provides the external lens to which you can compare and contrast your own performance, either at a service or organisational level. The additional enhancements around segmentation help then give you context as to whether or not that's reflective of our own experience by the nature of our services and the size of our organisation. In addition, there's been positive feedback from our stakeholders on how the data is presented visually, and that's helped them build their own confidence in how to interrogate data and extract insights that add meaning to their own data, particularly when you're looking at your own home and service to know how you're travelling. Thank you. So today I want to share just one of the practical ways Catholic Healthcare has used the performance report to drive improvement. The case study I'll share is focused on compliance in residential home care over the last couple of years. So Catholic Healthcare, like many large providers, has a dedicated and central clinical governance and compliance team who track and monitor quality performance. If I can cast your minds back to mid-2022, and we're still in the midst of COVID, our clinical governance and compliance team took the most latest report into our clinical governance meetings to highlight how our homes were travelling compared to the sector and state trends with regards to compliance. In that quarterly report, much as Tim shared earlier, the trends were in standards 2 and 3, and many of you would be familiar with that trend over time. At the time, Catholic Healthcare, much like the sector performance trends, had 20 unmets in standards 2 and 3 across its portfolio of 41 homes, mirroring the experience and the findings occurring across the sector. The operations and clinical governance teams took the time to unpack what was driving those unmets, and it was agreed that the focus be on standard 2 to shore up the systems and processes, which by default would get us a better result in standard 3 also. You can see some of those in the top corner there around the specific findings that the Commission were seeing during their visits. Once the drivers of the non-compliance were understood, the team set about brainstorming the actions that could be taken to close the gaps, and a list of practical wins that each home could implement was developed. You can see some of those there. They're also mapped to our clinical governance domains as well, so that we could tie those back under standard 8 as well. Those practical wins were developed, and in parallel, the central team worked on developing a risk matrix that would assist with proactively monitoring portfolio trends and give us a chance for early intervention, not waiting for those site visits to be able to spot the problems that we could address. The progress of actions through the preceding months were tracked via the compliance and risk meetings. And pleased to say that by mid to late 2023, not only had we improved our processes and systems that supported assessment and care planning, we were able to clear all of our unmets in this area. And I'm pleased to share, knock on wood, that this has continued to date. Our next goal is to take the performance data and use it alongside our own metrics to develop a set of key result areas and targets to be able to move care and quality beyond compliance. So both in my current role at Catholic Healthcare and previously at Uniting, the performance report's always been one of my go-to sources for information to drive change and improvement, both at the board, organisational and service levels. And its value is in the ability to provide an external lens or a mirror to which you can hold yourself up to and check and test how you're doing compared to others. It's an opportunity to share insights and to hear from your own teams about their experiences and what they might be learning and doing well, and to share that with your other teams. In terms of the recent enhancements to the report that Tim, Lisa and Louise have shared today, they're a really welcome improvement at Catholic Healthcare as we contemplate the next evolution of our benchmarking and performance reporting to incorporate the SBR data more seamlessly. Thank you for taking the time to hear a little bit about our story, Janet.
Oh, wow, Lana, that's brilliant. I really like your triumvirate of questions to identify the what, the so what, and the what next. If there's only one takeaway for providers from this webinar, I reckon you jot those down and you have your headings that, if you fill them in, gives you your plan. And I think that's brilliant. All right, I've got some questions for you, but I'll give you a break and come back to you. I'm going to start, Tim, with one for you. And the question is, will we, the Commission, be using star ratings in a future edition of our sector performance report? Do you want to take that one?
Yeah, thanks, Janet. I think star ratings is really interesting because of the data it uses, not because of the stars themselves. So, I mean, star ratings is for consumers primarily, and our approach is to try and make the data as actionable as possible for providers. So our focus is on the data that drives the star rating. So we've got staffing data driving one of the subcategories. We already have compliance in our reports, and we also have the quality indicators now. So we're really thinking about bringing in more of that consumer voice data that drives part of the star ratings. And we also bring in some staffing data. So as that data becomes more mature, we want to highlight those things which aren't technically the star ratings, but they're related to them.
Okay, thank you. It's really interesting looking at the questions coming in. They split into two different categories. In one category, we have people who are offering a commentary on the new configuration, new content, new format of the sector performance report. And in another category, we're getting people who are engaging specifically with the data and asking us questions about what we're doing in relation to fill in the blank. So I might see if we can go to a few of those, but I'll take the commentary on the report itself first. Lisa, there's a question here possibly for you and Tim, but it's a question around timeliness. Here we are talking about Q1 of 2023-24, so July to September last year. And because we were reformatting it, it took us slightly longer than we would normally take. But there is a question about whether we have plans to try to streamline the preparation of these documents in order to bring them slightly closer to the end of the quarter to which they relate. Lisa, do you want to take that one?
Yeah, thanks so much, Janet. That's a really absolutely valid observation in terms of the lag, and we want to do better, and we're working hard towards that end. We know that the timeliness of the data is really integral to its value, in terms of you being able to use it in real time for a response. So it is something that we're working hard on, and I say watch this space. We aim to get better.
Lisa, I'll stay with you. There's another question about the data behind the tables. Yep. And Catherine has wondered out loud whether we have any plans to make some more of that available.
Yeah, look, Catherine, that's a really great question. We have published with the sector performance report that we've showcased today. For the first time, we've included the Excel tables that sit behind. So that's available for providers to use and interrogate. The aim here is really to be as transparent as possible and to deliver data to you in a format that helps you use it in your own work.
Okay. All right, Lisa, I'm going to stay with you. There's a question about whether we plan to put financial or other types of performance that we also monitor and assess in future editions of the report.
Yeah, look, absolutely. That's certainly our ambition. Financial data in particular, we know that there's a very clear relationship between, the financial health of an organisation and quality of care. And the aim of the sector performance report is to try and bring together in one place all the things that we collectively hold in between ourselves and the Department of Health that can tell a story about the sector. So we do have some work underway where we're looking at that. That information belongs to the Department of Health, if you will. So we're having conversations with them about how we can apply it in our report.
Okay. Tim, one for you. Catherine is particularly engaged with your outline of the calculation of rates for serious incident notifications. And the first question was, are we using 1,000 occupied bed days? And I think it's 10,000, isn't it, for residential care?
Yes, 10,000, that's right.
And you said that we don't have a way of measuring an equivalent rate for home services yet. And she has suggested, and I'm not asking for your commentary in the webinar, but she suggested, could we use 10,000 service hours for home care? And you might want to take that one on notice.
Yeah, I will take that notice. I'm always interested in any kind of metric that helps us contextualize or control for the amount of care being given or the amount of people having care. So always happy to take any suggestions. So thank you for that, Catherine.
All right, there's one here which is a bit out of left field, but I would like to take it and put it to Lisa. Lisa, somebody is very interested in the strengthened quality standards, which will be introduced under the new Aged Care Act. And they know, I'm sure, that we've been doing a fair bit of work on it. Their question goes to Alice, our online training platform, and they want to know whether, and if so, when we're planning to include training packages on the strengthened standards.
The answer is absolutely, and we're wanting to roll those out as quickly as possible. I think you'll start to see the first of those products happening probably around late April, early May.
Oh, that's reassuring. That's great. Lana, question for you. You set out for us really clearly the structure of the committees in your organisation, which take reports from you and look themselves presumably at the sector performance report, and then oversee the way in which that relates to the work that's happening in your organisation across your services. Do you just want to offer a couple of top of head comments on that governance arrangement? Because that just doesn't happen accidentally. That is obviously fairly highly engineered to extract the best benefit from the data that's available to you, both sector-wide, but also from your own backyard. What's your perspective on that?
So well, and you're quite right, it doesn't happen by accident. You need really clear intentionality at the service level, the organisational level, and then with your governing body. And so where the sector performance report is, then it gives you almost that fourth lens, which is to say, like, what's actually then happening outside of the organisation. So we've worked really hard to get that board to bedside cadence around every home being able to monitor and manage their own piece, the next layer or the next line of defence being able to sort of track and trend and look for outliers, and then get that external lens through. So it does take work. The other piece is that you can get lost in the data, and I think it's not, oftentimes it's why I like the what, so what, and what next, is that you can get a little bit lost in it being accurate rather than stepping back and paying attention to what it's trying to tell you. So it's, what are you going to do about it? That's the real, that's the real call to action. So
absolutely agree.
It takes a while to engineer it, and it's not perfect. You'll find a fit that works for your organisation.
And because it's iterative, you're on a continuing learning improvement cycle, aren't you? And you want every committee member to understand that it's not going to be fixed for all time, because there are too many moving parts, including new older people coming into care who have different sorts of needs, which might present different sorts of risks, which need to be carefully managed, and so on. So it's very dynamic, and I think that's something else that's that we need to be careful not to overlook, that you have a committee structure, but they're looking at new data on a periodic basis, both for the sector and for your own service, and making sense of it, as you say. And the key is not to get so lost in the rabbit warren of more data, but to come out of that process and say, to use your own language, what next? What are we going to do about this? What is it saying to us? Your analogy of the mirror is a very apposite one. How do we see ourselves in this picture, and what does it say to us about the choices we should be making, or the priorities we're setting, or the training we give to staff, or the questions we ask, and so on? Its value really lies in that deep engagement with it. So thank you for explaining it so clearly. Tim, question for you on the segmentation of data. This is something that we've not done before, and it comes with certain risks. And I think there are some caveats that you would want to carefully outline. I know you mentioned them briefly on the way through, but just take us back to them. What can we deduce from that segmentation picture?
Yeah, so you saw on the diagram, we have, say different ownership types, for example, on the same diagram as different coloured lines. And people might have tried to say, well, that line's better or higher than that other line, or that colour's better than that colour. We weren't trying to say that particular segment was performing better than the others. In fact, what we know is that you'll need to look at all the data to work out what's going on, not just a single line. So really what we wanted to do was to make it easy for a provider to find their peer group, not necessarily to compare peer groups. That wasn't the intention. So in the next version of this report, we're going to make it a bit easier and to find your own peer group and make it less obvious about, we weren't trying to compare groups in that sense. So hopefully you'll see the next version. Look out for the next version coming out soon for a slight change there.
Righto. Okay, Louise, one for you. And somebody eagle-eyed has been looking at the data and noticed that the volume of complaints that we, the Commission, have received has dipped over the last 18 months. I mean, it's a very slow moving trend, but it has gone down. And the question is that a good thing? And should I, in a provider, be setting targets for my complaints to go down? Now, I know you enjoy these sorts of questions because it's certainly not black and white.
No, definitely not, Janet. Look, I think the crux of the matter is we want people to feel comfortable to raise complaints. So we really want to avoid a situation where setting a target, like a provider setting a target to reduce complaints, or us setting a target for you to reduce complaints, means that complaints end up being discouraged. What we really want to see is that providers are working to resolve the complaint quickly and effectively with the care recipient and their family and supporters, without it needing to be escalated for the Commission to intervene in. Now, we want to know if, rather than just looking at the numbers, what you are looking at is what the complaint is about and what it's telling you about the care and the relationship you have with that care recipient. Why was the complaint raised? Is there a cluster of issues, and what can you then do in response to that, practicing some open disclosure along the way?
Yeah, thank you. Well said. I was just noticing there are a number of comments and questions around the serious incident response scheme, to the point where we may well take that offline and take that as a bit of a clue that there's a level of interest in us doing something separate on serious incident response notifications, because judging by the questions we've received, there's a lot of interest out there in it. So thank you for that. Lisa, Kevin has asked whether we're going to share the slide presentation. He seems rather keen on seeing whether it can be used by him, but also by others, and also so he can provide feedback on it.
Yeah, thank you. We're certainly delighted to share the Commission's slides. I think Lana will need to make a call about what she'd like to do with her slides, but for the Commission slides, we're very happy to share.
And of course, this webinar is being recorded, and a copy of it will be available on our website in a couple of days' time. So for those of you who want to watch it again or recommend it to your peers and colleagues, you can certainly see the slides through that process too. Let me just see if there's another question that I can pick up before we go. Lana, perhaps the last word to you. It's clear from all you've said that you've found great value in what we've published. We would be very pleased to work with you and all providers on improving the content further. Is that something that you see as being useful, that sort of engagement with us to assist us in getting the best possible publication?
Absolutely. I think one of the opportunities is to partner to work to solve the same problems. And so many heads, many different angles make for a better outcome. I think from a provider's perspective, we've got data in lots of different places. We submit it via lots of different places, and to see it come back to you in a more consolidated format where you can see your SIRS and your quality indicators with your complaints, with your compliance, is actually really helpful to be able to line that up. So anything we can do to make good use of the data and the indicators that we supply and have it come back and be meaningful, both to yourselves in terms of driving quality outcomes, but us in terms of delivering better services, is very welcome.
Thank you. And Donna has asked how a small or medium provider could approach the same issues as Catholic Healthcare does as one of our larger providers. I think that's a really important question. It's a question that we often engage with, because we understand that what works for a larger provider with a larger corporate area may not be fit for purpose for those of you who are smaller and have fewer staff who can do this sort of work. And if you have particular questions in that regard, given that we're pretty much out of time, drop us a line, contact us, send through an email, or use our web form and say, look, I'm really interested in hearing whether there are other providers of my size who would be equally interested in figuring out what we can do to engage with the data, where we don't have a large corporate section or team who can assist us with the sort of analysis that maybe Lana has managed to pull together. Don't be a stranger on this. We're very keen for our products to be used widely and well. And as you heard from Lana, where they are used in that way, they do make a difference. And we're very keen to work to support you to understand your performance and to understand where you need to lift it and how you might go about that process. So thank you, everyone. That brings us to an end of the webinar. My great thanks to Lisa, Lana, Louise, and Tim for joining me on the panel today and for the work you've done in sharing with us so clearly the work that's happened through the sector performance report and the use that can be made of that data. A quick reminder, there is a short survey. I'm told it will pop up automatically at the end of the webinar. Please stick around, fill it in. It won't take you long. We're very keen to hear from you, to get your views on how this has been for you, but also so that you can tell us what more we can do for you and with you. As I said, the recording is going to be available on the website. So that brings us to an end. Thank you very much for your questions and your participation. We look forward to our next engagement next month. Bye, everyone.